Good morning, I'm Greg Stock, CEO of Thibodaux Regional Health System. It's a pleasure to be with you for a few minutes this morning to provide an update regarding the coronavirus issue. First of all, I want to say that as far as Thibodaux Regional is concerned, I feel good about the effort that's being made. The plan that we have put together earlier and then, of course, changed almost on a daily basis is working well. And I think that within our capabilities and within the need that we see, that we're performing at this point at a high level. We hope to continue to do so. I'd like to share with you a few things about our experience so far and be transparent and provide information that might be helpful for you to know. First of all, at Thibodaux Regional, we have tested 188 people. When we say we have tested, that means that we gathered the specimens and sent them to reference laboratories or to the state laboratory. Hospitals don't actually do the testing yet. And then about 7 days later, the tests come back. At Thibodaux Regional, 63 of those tests have been resulted. And out of that set of numbers, there are 19 positive, meaning those are confirmed coronavirus cases. So that number is about 30%. 1/3 of the 30% are inpatients at Thibodaux Regional, not nearly 100%, and there are no deaths reported at our facility. So I'd like to discuss just for a moment or two how you get to those numbers. As I said, we do the specimen collection. We send to the state and/or reference laboratories, and they report back. We report to the physicians who those patients are attached to. But those patients can come to us in our emergency department where they're seen and the signs and symptoms are not necessarily real serious looking, but enough that the doctors would want to test them. And so they're sent home with guidance on how to stay separate from others at home, all the things that have been said there. I won't go over those until they get the results back. So when the results come back, we call them and let them know. The other ways that these can be confirmed is that they actually happen in clinics, so that physicians see a patient in the clinic and they send the test specimens off and get the results back. We may get those patients later, possibly, if the underlying health conditions and their overall condition merits hospitalization. Right now, I really just want to express our deepest appreciation to the community, not just Thibodaux itself, but the whole region, 5-parish area, for their encouragement, for their support, for the feedback that we received, and for the opportunity and privilege we have to serve this whole region. Wonderful, wonderful people that live here, how patient and understanding they've been as we've enacted things that we think protect the patients and the staff from further infections. And as we continue to make changes almost daily, we just see such great things from the community, and it's on behalf of our entire staff and all our physicians and our board of directors, I thank you.